Let's see. Yeah, we were on strep. All right, let's roll, folks. All right, Mabel, follow along now. All the stuff is in your notes. Follow along. Everybody ready? Page 27, Mabel. We're on page 27. Oh, 827. Yeah. Oh, yeah, Mabel. Hey, Mabel, you there? Mabel? She took a coffee break, eh? All right. We'll see you later on. All right. Tell folks outside. Kathleen, tell them to come on in. I'm about to go. Because once I roll, you don't go fast. So I don't want anybody to miss the buzzwords. That way, in case you have any questions, just ask me. $827. Let's go. And here we go. Strep now. Streptococcus is the only gram-positive cocci in chains, whereas staph was gram-positive cocci in clusters. So chains, clusters, make sure you keep it straight. All right. There's grouping for strep, group A, group B, group C, and D. And then there's hemolytic reaction, alpha, beta, gamma. Now you can bet I tried to make all the alphas become group A and all the betas become group B. Didn't work. It wasn't even 50% accurate. So it's not worth it. All right. But what they usually do is describe the hemolytic reaction anyway. And then, or they'll give you a clue for the bug. So that they don't expect you to know the two lined up. So alpha hemolysis means no hemolysis. Partial hemolysis. You get a green zone. Alpha hemolysis means partial hemolysis, green zone. Beta hemolysis means complete hemolysis, clear zone. So remember, they'll describe the petri dish the next day. And then gamma hemolysis is no hemolysis, so it's still red the next day. Green, partial, clear, beta, and then gamma, none. The reason why they were surprised when they saw that, they thought, hey, wait a minute, strep doesn't have any enzymes. How's he eating through a blood clot? That's how they discovered streptokinase. It's just an accidental finding because strep doesn't normally have an enzyme, but they found out he does. All right, group A, B, C, and D. There's two of them in group A that you want to be familiar with. Strep pyogenes. And get used to whenever you say strep, say the last name, because otherwise you're going to forget which strep you're looking for. There's a lot of them sound alike. Let's say pyogenes, pyoderma. And all of a sudden now you're staring at both of them. Oh, which one was that again? That's because you forgot. Say the first and last name. All right. So strep pyogenes, most clustered in the back of your throat, most common cause of all the pharyngeal infections that we talked about. All right. On the skin, he's number 2 behind Staph aureus, except the 5 infections where I told you he's number 1. Like name one, Abigail. One skin infection where strep is number 1 and staph is number 2. Give me one skin infection where strep pyogenes is number 1 and Staph aureus is number 2. I gave you 5 of them yesterday. Let me ask Ayushi. No, lymphangitis. Lymphangitis. Yeah, remember there's a lymphadenitis, but that's the wrong infection. Remember I gave you the mnemonic lines. You have all 5 right there. Okay? So strep pyogenes. I also told you there were 70 strains of strep. So you can explain to a mother why a child keeps getting strep throat over and over again, and it's not your fault. Otherwise, they won't understand. The thing is, you're not giving this kid a strong enough antibiotic. All right, strain 12 causes most of the post-strep GN. And then I showed you how strep throat leads to rheumatic fever because you aspirate pieces of the antigen. They get stuck to your valve, mitral valve, and then there's this cross-reactivity. And now your body starts attacking the valve. All right, rheumatic fever. I'll talk about that in a second. Oh, no, I'll talk about it now. Anyway, the Jones criteria, I like to use another one that I made up, SPECC, SPECC. It's the same thing as Jones criteria. S is for subcutaneous nodules. P is for polyarthritis. And it's usually migratory. That's what's unique. It's just from one joint to another. Because if you have true arthritis, it shouldn't be jumping around. That's because this is not true arthritis. The inflammation is around the joint, but not within the joint. E is erythema. Oops, sorry. Marginatum. Little red dots with bright red margins, which is how he got his name, marginatum. Little red dots with bright red margins. Then there's chorea, Sydenham's chorea. If you have a movement disorder, what part of the brain has been affected? Angeline. If you got a movement disorder, what part of the brain has been affected? Frontal is abstract reasoning and personality. Movement disorder, Cesar. That's basal ganglia. It means rheumatic fever loves to attack the basal ganglia. So Sydenham's chorea. And then carditis is the last one. Now, when you have acute rheumatic fever, you get myocarditis. If you have myocarditis, you expect to hear an S3 or S4, Melissa. All right, Josh? You got infection of the muscle. It cannot contract very well. So it's going to dilate. All right, so that's an S3. All right, so acute rheumatic fever, you get myocarditis. So you can get everything that goes with myocarditis. That means it can stretch the valve, so you get regurg. That's common. All right, but anyway, chronic rheumatic fever, you get endocarditis. And the most common one, mitral stenosis by itself. And I showed you how it gets to the mitral valve easily. Then there's mitral stenosis and aortic stenosis together. That's because whatever's left leaves the mitral valve and goes stick to the aortic valve right after that. And then there's aortic stenosis by itself. And then there's tricuspid stenosis if anything is left to come back around. Give me the murmur for mitral stenosis, Miguel. Give me the murmur for mitral stenosis. Describe it. I don't know what that means. What's the murmur described as? Systolic or diastolic? No. A stenotic valve makes a noise when it's supposed to be open. Remember, I told you guys, organize yourselves. The brain loves guessing, but you got to catch when the brain is starting to guess. All right, stenotic valves make a noise when it's supposed to be open. So you should have asked yourself, when is it open? Diastole. That's how you know it's a diastolic murmur. It can't be a systolic murmur. All right, so it'd be a diastolic rumble was the noise I gave you guys. All right, would it have an opening snap or ejection click, Angela? Mitral stenosis, opening snap or ejection click? Opening snap, because opening snap is a diastolic noise only. Okay. All right. So anyway, there's the diseases that they expect you to know. How do I make the diagnosis of rheumatic fever? Chorea by itself and then a preceding strep throat makes the diagnosis. That's because when the brain is already affected, we're not going to wait for something else. So it makes sense to me. Otherwise, you need 2 major criteria from these 5 and then a preceding strep throat. That means by culture or the rapid strep. So that's the current way to diagnose rheumatic fever today. So the most common is PC, politically correct. So polyarthritis and carditis. So to give you a child who had sore throat a couple of weeks ago, and now today he's talking about, oh, his joints hurt. And then when you finally see him in the office, he's got, tender joints, and then he's got a new murmur that wasn't there before when you last saw him. You got to know they're going for rheumatic fever. The rule is, if they have no valvular disease, when they get better, they need to be on aspirin for the next 5 years because they're at risk for clots when that clot's been attacked. If they have valvular disease that then goes away, they need to be on it for 10 years. But if they have valvular disease that stays, they need to be on aspirin until age 40. That's the current recommendation. Now you know how it presents, how to make the diagnosis, and how to manage it. Yes. Rheumatic fever is a childhood illness. Yes. Yeah, rheumatic fever has complications that are 20, 30, 40 years down the line. But you had rheumatic fever starting as a child. Then they get to mitral stenosis 30 years later. Yeah, the strep throat happened while you were a child.
So why did they call it strep throat and
No, rheumatic fever means an autoimmune complication of strep throat. Yeah, that's because rheumatoid, that means joints get involved. That's why they go. You don't have to have a fever, no, but they usually do. Because there's inflammation. Anytime there's inflammation, you get a fever. But that was the original name because these children have fever, and as an adult, they still have fever because the joints are being inflamed.
child get the heart issue?
The child gets the heart issues for acute. They get the myocarditis because that's what happens acutely. Long term, they get endocarditis, which is the stenotic valves. Okay, so strep pyogenes. Another strain. Let's see. Another. This is a stain. Anyway, there's a stain they're using for strep pyogenes now called pyrodolil something. Anybody seen this word? Okay, if I see it, I'll. Yeah, see it. Do you know how to spell it? What? Leslie, do you remember the name of this new chemical they're using?
No, I don't remember.
And it's pyrodolil. It sounds like pyogenes. That's how I remember it. But it's Pyro pyrolil. I just remember the first half of it. Pyrolil, something like that, and then something else. It's a new stain that they're using. Anyway, just introducing it because it's so new. I don't remember everything about it. But I know that now anytime you see this, that's strep pyogenes. All right, Leslie, you have a question?
Yes, can you repeat the timings? Like aspirin for 5 years if
5 years if they have no valvular disease at all. 10 years if they have valvular disease that cleared up. And until age 40, if they have valvular disease that became permanent.
Thank you.
Yeah, no problem. Now, that's strep pyogenes. Again, number 1 for the 5 skin infections, number 1 for all the throat infections, also number 2 for skin infections behind staph aureus. All right. And then group B strep is strep agalacea. This is normal rectal flora. But whose rectum are we interested in? Remember, a pregnant mother. When do we check our rectum, Melissa? When do we culture? 36. Just remember the week before term. Yeah. So we check the vaginal introitus and the rectum. And a positive culture means you grow out more than 100,000. We know there's going to be some group B strep. It's just whether it's over 100,000. And if it's positive for over 100,000, Ida, what do I do? Group B strep grows out over 100,000 at 36 weeks. What should I do? Not prophylaxis. That's not the way you want to say it. Let's see. You got it? Start ampicillin when she comes in labor, because we want to try to get in at least 4 hours of continuous infusion to make a difference. Otherwise, the ampicillin doesn't make a difference. Okay? So be careful. They're going to have answers about treat it right now, do this right now. None of that is true. It's just when she comes in labor, then we do something. Okay? All right. So if GBS is positive for a mother, or you don't know of any history, that means she just came in as your patient through the ER. So we have no records. Okay? You have to know, number 1, there's an increased chance of preterm delivery. Okay? Number 2, you have to worry about that baby as soon as he's born. They say mom has a history or no known culture being done, then you keep that child in the NICU for 48 hours. Okay. All right. Then now they're broken up to before 35 and after 35, depending on whether they're almost term or not term. So if they're under 35 weeks, they say keep in the NICU for 48 hours, full septic workup, start on antibiotics, remember ampicillin, gentamicin, until you make sure that culture is negative. In other words, don't sacrifice the child's life. All right. But after 35 weeks, the child is pretty healthy. Then it's just hold them in the NICU, but you don't have to do a full septic workup. They say, but observe that child. All right. That way, if there's any change in status, boom, full septic workup, lumbar puncture, antibiotics, and keep them there for a week on antibiotics now. Okay. So that's the new recommendation. This is again, if mom was positive in the past, or there's no history of whether she had a group B culture, that's usually somebody coming out of the emergency room, or homeless person walks in, all of a sudden they're pregnant, you find out she's about to deliver. We have no records whatsoever. That's the recommendations. All right, so that's strep Egalacia. C, group C strep, we don't have any names for them yet, but they cause pharyngitis, and that's the only question I've seen twice now. And it's like years apart, and I wonder how many years does it take to name a bug? It just means that they argue a lot at their annual conference, and then they go home, and nobody named the damn thing. I mean, it's been years since I read that. Oh, we're getting around to it. And then years later, I read again. Still causes pharyngitis, but we haven't named it yet. I mean, it's crazy. That's doctors always arguing. All right, anyway, group D strep, there's two groups here. Strep viridans. Remember, three guys here. Mutans, sanguis, and salivarius. All right, strep viridans. First clue, remember, produce a green pigment, virid. It's Latin for green. Second clue, attaches to the mitral valve, loves the mitral valve, eats right through it. And what do you get? Mitral regurg. Describe that murmur, Gloria. Holosystolic murmur gets louder when you inhale or exhale. Exhale, and then radius into the axilla. All right, so strep viridans. And then subacute bacterial endocarditis is the name for it. Name one. Give me one name for a septic embolism. Bailey. No, not PE. You can't get PE from the left side. PE is if it's on the right side. Septic embolism. I'll give you guys 5 names for them. Hang on, Steve, start you off. Janeway lesion. Yeah, remember Osler's nose, splinter hemorrhages, mycotic aneurysms, raw spots. Okay. The only one that's not a septic embolism is Janeway lesion. That's just vasculitis, by the way. But anyway, as long as you knew the list. So strep viridans, mutans, remember, mutates your teeth is one that causes cavities. You know they're going to ask about that one. And then sanguis and salivarius are found in your saliva. Salivarius antigens are used to do the cryoglobulinemia test. What's the most common cause of cryoglobulinemia, Solange? Most common cause, Amy. Cryoglobulinemia. Give you guys a mnemonic to remember it. Nolan. All right, does anybody remember it? All right, Jess. So what's the most common? Yeah, all right, influenza, the flu every year. Yeah, flu is the most common cause. All right, so anyway, that's strep viridans. Next one here is Enterococcus. Enterococcus attacks hospitalized patients and immunocompromised. Otherwise, normal people don't get this. And there's fecalis and facium. In other words, he just likes to play around your poop. That's it. Enterococcus. Remember, nitrite negative UTI. We rehearsed that many, many times. But again, attacks only hospitalized patients and immunocompromised. Healthy people don't pick this up because it's part of your normal flora. That's why. The only drug that covers enterococcus is vancomycin. How does vancomycin work, Nolan? It blocks the transfer. It blocks the DL and DL from coming together at all. All right. That's why it's the most effective gram-positive coverage drug in America. All right. So enterococcus. So if you got vancomycin resistant enterococcus, we call them VREs. On them, what's the first thing you do? Isolate the patient, negative pressure ventilation room, and then hit them with linezolid. Same things again. Please don't forget, isolate first before you go marking the linezolid as the answer. All right, did you have a question, Anna? Okay, yeah. No, I'm about to do strep pneumo. They're actually moving strep pneumo out of this family. I don't know if you guys knew that. Yeah, they're creating a family called pneumococcus. That's why you see a lot of books. This is transition years. Just kind of get doctors used to it. And the books always say strep pneumonia, pneumococcus, strep pneumonia, pneumococcus in parentheses. And then eventually they're going to phase out strep pneumonia. All you're going to see is pneumococcus now. Okay, but they're just getting you ready for it. All right, so let's talk about pneumococcus. Pneumococcus, they realized, even though it was given the name of strep, he's not really a strep. So that's why they're creating his own name, which is pneumococcus. Why they take him out of his family? Several reasons. Number one, he's the only gram-positive Diplococcus. Travels in pairs. No strep travels in pairs. I said, wait a minute, it doesn't look anything like a strep. That means somebody made an error a long time ago. Okay. So the only gram-positive Diplococcus is pneumococcus, and that's nothing like the rest of the strep family. Second, he's the only gram-positive with a capsule. There's no other streps with capsules. Again, makes no sense. How come he's the only one that gets a capsule if he's truly a strep? Third, pneumococcus has 80 strains. Strep pyogenes only had 70. That's when they realized, okay, this guy's completely different. 80 strains. And 23 strains cause 98% of infections, which is how they came up with the Pneumovax 23 vaccine. The problem was, Rachel, Pneumovax 23 vaccine was a suspension vaccine, whereas bacterial vaccines are supposed to be made how? What's the best way to make a bacterial vaccine? For the viral vaccines, we said live attenuated, except the 4 that could kill you. For bacterial, I gave you the way we make 99% of them. Anybody remember how we make them? Laurent, conjugated to some hapten, or rather some immunogen that amplifies its response, okay? And this was just suspension. All they did was just take pieces of each capsule and put it into a liquid. That's not conjugation. That's why they never got good numbers. 77% was the last article I read years ago. Whereas Prevnar, when it came out, 98, 99, because it was actually conjugated. And I told you they're trying to phase out Pneumovax. They're up to Prevnar 20 now. Probably within a few years, Prevnar 23, that's it. Pneumovax 23 is gone. Okay? So imagine if the company who makes that's billions of dollars you're about to lose out on. You're seeing it disappear year by year by year. But you had, whatever, 30 years to fix this and you didn't, it's your fault. All right? Another company said, well, they're going to do the right thing, and boom, you just lost the whole market. All right, so pneumococcus. This is the capsule is a carbohydrate. There's a sugar. And you can use something called a Quellung reaction to isolate the capsule. It just makes the capsule suck up water, so then it swells and separates from the bug. You see a little black dot in the middle with this big capsule around it. Quellung reaction. Anyway, anytime you see Quellung reaction in any vignette, you know they're going for pneumococcus. Whereas pneumococcus reigns supreme, #1 cause of meningitis overall. Remember, after 2 months of age, pneumococcus #1 cause of meningitis, except between 10 and 19, where teenagers, Neisseria meningitidis. And then from 19 till whatever, till forever, it's all strep pneumonia. So that way, when they ask what's the most common cause of meningitis, if they don't put an age range, the answer is pneumococcus, period. Okay? Strep pneumonia is also the most common cause of all your respiratory infections. Remember, it's in the back of your throat, it just crawls in when the cilia get paralyzed. Strep pneumonia, H. influenza, Neisseria catarrhalis. So all respiratory infections, same 3 guys. First line drug, amoxicillin. Hopefully everybody still remembers this. Amoxicillin, first line for all respiratory infections. If they're not better than 7 days, add clavulanic acid, repeat. And that works in the majority of cases. Any questions on strep or pneumococcus? Angie? Strep bovis is part of the Enterococcus family because in the GI tract. Strep bovis, or Galileticus. That's the other name now they call it. All right. That, remember, it's associated with colon cancer. That's all you need to know about that guy.
With amoxicillin, so if the patient has a penicillin allergy, you get all the translate to amoxicillin.
No. If somebody's allergic to amoxicillin, you don't use amoxicillin now. You can either macrolides penetrate the lungs real well, or clindamycin covers most of them. Yep. And therefore it's not related to penicillins. All right, moving on. Remember I told you they found streptokinase from strep? And that's why you need to know this. Again, you heard this in the clotting lecture. Urokinase, streptokinase, tissue, TPA, and then alteplase that they brought back from the past, right? Alteplase. These are the 4 thrombolytics that we're using. What do they do? They all do the same thing. Steve, what do they all do? They break up clots. Gee, I wonder what that means. You can't give me some general statement like that. That doesn't get a point on the test, man. Remember, I said be specific when I ask you about a drug, folks. Don't go to that exam with general statements. It won't get you any points. What do these drugs do specifically? Jess. They what? No, they don't break down fibrinogen. Let's see what Miguel said. Convert plasminogen to plasmin. Plasmin breaks down fibrinogen. So make sure you got the key word. You understand? You understand, Steve? You'll find the answer quicker if you just look for plasminogen rather than just thrombolytic. That won't get you any points. Okay? Remember, I told you, don't give me general when I'm asking about a drug. All right, so that's how they work. If you want to reverse them, you can use aminocaporic acid, or now they're using cryoprecipitate because it seems to be working better. So update on thrombolytics, reversal. Use cryoprecipitate. That's not there, then look for aminocaporic acid. All right, meningitis throughout the years. I just added the slides just so you know the current list. That part there is memorization. Okay, but it's good to have. Corynebacterium diphtheria looks corny because it looks like Chinese letters. They actually describe them that way. He has a toxin, ribosylase EF2. Who else has that same toxin, Karis? Ribosylase of EF2, besides diphtheria? Not Shigella, Melissa. Pseudomonas has the same toxin. Elongation factor stops protein synthesis. That's why cells then die, slough off, and mix with mucus. That's how you get that gray membrane in the back of your throat that diphtheria has. But that gray membrane can shut off the entire airway. That's why when you see it, they always say don't scrape it. It is so vascular. If you scrape it, the person can actually drown in their own blood. Okay? And diphtheria can cause heart block. I gave you the timeline for it. I just put it here again for you. And big D becomes a little d. Remember, after age 6, what's that little d for? Serves as a carrier for all the other vaccines. Not because anybody gets diphtheria after age 6. Any disease with a toxin, remember, antitoxin is the first thing you do before the antibiotic. Again, be careful about just rushing straight to the antibiotic of choice. They know that's what the book told you, but look for basic things first. As a physician, you always got to remember, stabilize your patient before you worry about the drug of choice or the treatment of choice. Make sure the patient's going to be alive when you get ready to use whatever drug of choice. All right, 80 ribosylators. These are the ones you need to know. GS, Vibrio, Cholera, and ETEC, GI, Bordetella pertussis, and EF2 that we just did is diphtheria and pseudomonas. Steve, question? Big D becomes little. That means half dose of diphtheria at age 6. But that's just to act as a carrier, not because anybody gets diphtheria after age 6. All right. Cause heart block. Remember, these are 5 infections that cause heart block. Everybody should know it. And remember, the way they're going to hint at it is the heart rate is not as fast as you expected it to be. They're not going to tell you the patient has a heart block. You got to figure that out for yourself. Okay, but anybody comes to ER, they should be tachycardic because they're stressed out from being there. There's no way you should be having a normal or low heart rate. That's a heart block. Okay, and there's the 5. Spore formers. Cares. That means they take a ribosyl phosphate from ADP, they use ADP as the energy to tag on to something. Yeah, the problem now you got this big ribose phosphate stuck to something. That's why it can't work anymore. Yeah, there's a sugar and a phosphate that's attached to something. Yeah, that's it. It just messes up this function. Spore formers, Bacillus and Clostridium, only two guys. So anytime they say a bacteria with a spore, you only got two to choose from. All right. A spore is the dormant form of a bacteria, of these two bacteria anyway, made up of calcium dipicolinic acid. This thing is hard as the shell of a clam. That's why a clam can live at the bottom of the ocean, 20,000 feet underneath, not even bothered at all by the pressure. Whereas that pressure crushes most things. Okay? But this spore lives inside of you, not bothered at all. That's why acid, base, hot, cold doesn't kill it. The only way to kill it is called a sterilization process that we discussed. That's 121 degrees Celsius, vaporized heat. That's almost 500 degrees Fahrenheit. So this should be Celsius. And remember, it has to be vaporized heat for at least 15 minutes, which is what autoclaving is. And that's why that's part of the protocol for cleaning things in the hospital. You have to put them in an autoclave. You got to kill these two guys. Bacillus, what do I need to know? He has a membrane, not a capsule, but it's a membrane full of D-glutamic acid. What type of amino acids do we have? L amino acids. So a D amino acid is as strange as it comes, which is why it invites a very violent response from your body. And remember, I told you it's the response that actually kills the patient. And that's why anthrax, you even touch it on your skin, all of a sudden that piece of skin necrosis. That's how violent the reaction is. And then think about the people who inhale it, it necroses their lung, which is why they die. It has a toxin made of three parts. One is the lethal factor, the one that kills you. Second one is a edema factor, the one that causes swelling. And then the third one is protective factor, protects the other two. So again, this was a good old days. They would name it based on what it did. You never had to guess. All right. Cutaneous anthrax is described as malignant pustule because the skin would necrose real quickly. Pulmonary anthrax, also known as wool sorter's disease, is what kills the majority of people. So if you work in a wool factory or in a farm shearing sheep, then I know that's where they're going. Be serious. We saw this morning in the question. Gastritis associated with fried rice, especially when it's left out. Fried rice. Clostridium, C. difficile, gastritis associated with antibiotic use. We talked about it twice already. Most effective antibiotic now, remember, vancomycin. We don't use metronidazole, so I gotta erase this now. We don't use metronidazole at all anymore. The disease is called pseudomembranous colitis. And the antibiotic with the highest incidence of doing this, Angeline? The antibiotic with the highest incidence of pseudomembranous colitis. No, vanco's the treatment. I want to know who causes it. Melissa. Huh? There's an antibiotic that causes the most cases. Clindamycin causes over 40% of cases all by itself. And that's why physicians use less of it now than we used to back in the 80s. Yes. Every antibiotic has been shown to cause it. Even Pen-V, I've seen literature. Some cases, not that many, but there's cases that with just Pen-V alone, the simplest penicillin can also cause it. Remember, the key is you're killing off my normal flora. Every antibiotic you give anybody can kill off some normal flora. So it makes sense to me that any antibiotic can cause it. Okay? All right. Next one, Clostridium perfringens causes gas gangrene, usually in the leg of a diabetic or somebody with severe vasculitis. You feel subcutaneous crepitus as bubbles. All right. The problem with gas gangrene is if that blood supply returns and connects back with your veins, all that oxygen bubbles can enter your lungs. You get showered a bunch of PEs and die. That's one way to die. There's another way, even more severe. If these air bubbles travel up to your heart, they collect in the right atrium, drop down the right ventricle, and then rise right back up and clog up the pulmonary artery. And all of a sudden blood can't leave. It presents just like a tamponade. That's how I know this one. If somebody who has gas gangrene, then all of a sudden they fly out. Boo! You got to know there's a big bubble right here in the right ventricle, and it's up here at the top. Your pulmonary artery is more medial like this. What we do, roll them to their left side. See that? The air bubble would then roll to the right like that, out of the way. Their pulse and blood pressure come back. And then we pound on the right side like crazy. That's because you're trying to break up that big bubble into tiny bubbles and then shower the lungs. Yes, you get some PEs, but at least you're still alive. Little tiny bubbles that usually don't kill you. Yes. Yeah, this is like the epitome of air embolism. This is bad. And if you got gas gangrene and then it collects and goes, oh boy, it's bad. I mean, they just flatline. The air embolism that he's talking about is usually if a nurse injects a syringe into somebody and there's an air pocket in there, then you can do the same thing, inject the air bubble, and it'll collect right in there, right ventricle and kill somebody that way. But they do the same thing. All right, that's C. perfringens. Then there's C. melanogosepticus. Remember, this is again associated with colon cancer. And then it produces a very black pigment, which is why it's called melanogosepticus. All right, along with strep bovis that we already talked about. Next one, Propionibacterium acne causes acne. This guy leads deep into sebaceous glands, away from oxygen. That's how you know he's a gram-positive because he's on your skin, but it's an anaerobe because he's hiding all the time from it. Progesterone stimulates propionic acid, which is his favorite fat to digest. This explains why teenage boys have bad acne, because that's when teenage boys go through progesterone on the way to testosterone. Remember 17-hydroxylase. You got to go through progesterone to get to testosterone. All right. Same reason why boys get gynecomastia of adolescence. All that progesterone, while it's rising, stimulates the breast tissue, and they get breast tissue, and they hate it. All right. But you'll have a mom who's going to call you because the son wants it cut off. Reassurance. You just got to talk to him. All right, I had a nephew who had this problem, and mom calls me. Could you tell me who's a good cosmetic surgeon? My son wants his breast taken off. I'm like, what? Breast taken off? Yeah. He's being teased at the pool. You know, kids don't know anything about physio. They just see a kid shows up, he's got boobs now. Hey, Charlie got boobs. Look at that. And of course, they're ridiculing him the whole time. And he was that distressed by it that he wanted surgery right away to get that thing cut off. You know, so I just had to talk to him. I said, man, today you got boobs. I know they're making fun of you, but I'm telling you, soon you're going to be big and muscular. Those things are going to turn into big old muscles. Is that going to be good? Yeah. Anyway, you play with them just to make them feel good. And they say, oh, these going to turn into muscle. Oh, I'm okay with it now. You see? And then you tell them, just wear a t-shirt when you go swimming, just so everybody doesn't have to see it. But it went away and he's got big old muscles, just like I told him. Anyway, but he wanted surgery because he was so distressed by it. Angeline. Man boobs, is that what we say? Yeah, anytime man has too much estrogen, yeah, you get boobs or too much progesterone, boobs. Because remember, estrogen stimulates the ducts, progesterone stimulates the glands. Either way, you're gonna have more breast tissue. Yes. Why do cirrhosis patients have gynecomastia? Somebody in this room is gonna answer this question. Jess, break it down. No, it's not because the liver makes estrogen. You're on the right track, but it's not because the liver makes that estrogen. There's something else that you needed there. All right, Angeline. So it's because the liver cannot get rid of the estrogen. Remember, every man produces estrogen from adipose tissue. Everybody does. But your liver as a male will get rid of it for you. Same thing with a female. So that means anytime you have cirrhosis, the liver can't do anything. That means it can't get rid of estrogen either. And that's why you get, remember, small testicles, small penis, gynecomastia, see, all that. You get pulmonary edema, that's all estrogen, vasodilation. Physio. Curious. Chronic marijuana use leads to gynecomastia for the same reason, by way of liver toxicity. Was it another one? Tofu. Tofu is rich in estrogen. Yeah. There's been a lot of cases of gynecomastia in secondary tofu. Yeah. Yeah. Yeah, that's correct. That's it. Anyway, again, it's the physio, folks. That's why I want you guys to learn physio, because nobody has time to read every article that comes out in print. Melissa. Yeah, remember for male, we aromatize estrogen to androgens. The female aromatize the androgens to estrogens. It's the same aromatase. Yeah, because it goes in either direction. All right, refer to a dermatologist when somebody has acne, when it's nodular or nodulocystic. Why? That's a boil. That means that's an abscess waiting to happen. And a lot of children have died. Well, not children, teenagers have died because they keep popping their zits. And they don't realize that's an abscess waiting to happen. And all you did was introduce a little Staph aureus in there with your finger, and boom, dead. Okay, so that's why they say when it's nodular, nodulocystic, send it to dermatologist because you need to get some serious treatment. That's usually retin A at that point, or a good, strong antibiotic. All right, there's a gram-positive anaerobe hides in the hair follicles. White comedones, we can say whiteheads, that's just a clear vesicle. And when it gets oxidized, it turns black. So then people say blackheads or black comedones. What is an anaerobe's worst enemy? Remember I said it was oxygen. Notice why it's called Oxy 5 and Oxy 10. Notice the concept didn't change, but the name just changed. It's just oxygen bubbles in a cream. See, but then if you don't know that, you just start memorizing. Oh, Oxy 5, Oxy 10. You still don't see. It's the same treatment. Nothing has changed. All right. Benzoyl peroxide, H2O2. That's oxygen in it. Sounds like the same thing to me. Stridex pads is a very abrasive pad to lift the skin off the surface so oxygen get in and kill this thing. Notice nothing has changed except the name has changed again. That's what I said, folks. Make sure you learn the concept first, then the details will make sense. You don't have to memorize it. As far as antibiotics, we like minocycline first. Why? Because it's anti-inflammatory, not because tetracyclines kill acne. It doesn't. It doesn't even kill the bug at all. But we know that people are concerned about all the scarring they get from the inflammation, and tetracyclines are good anti-inflammatory drugs. Minocycline is the best one. Clindamycin covers anaerobes, so that one's straightforward because it's an anaerobe. Macrolides are also anti-inflammatory because macrolides don't cover anaerobes. But just so in case you're asked, how does it work? Don't go picking this normal accent. They're both anti-inflammatory. That's it. Retinoic acid is the one we like when it gets to nodulocystic, because if you don't take care of this stuff, it's going to get worse. So we like retinoic acid, which is pre-vitamin A, causes proliferation of skin cells from the bottom, which then push P. acne to the surface, and then he dies because now he's exposed to oxygen. Notice again, the concept stayed the same, but the name just changed again. It's the same concept, folks. Concepts don't change. They just change the stories and the names. Details, that's details. All right, main side effects of retin A, just think of vitamin A. Hyperlipidemia, because you got to absorb some fats to avoid, to absorb a fat soluble vitamin. Hyperparathyroidism, because vitamin A is a cofactor of PTH. Pseudotumor cerebri, because vitamin A is used by choroid plexus, and it's teratogenic, so we don't use it in a pregnant woman. So if you're going to start a female of childbearing age on retinoic acid, she has to sign an agreement that she knows she has to stay on birth control the whole time, because we don't want her to get pregnant and then she's trying to blame the doctor. Okay. Isis, you have a question?
Yes, Dr. Francis. Out of curiosity, how is it that retinoic acid affects pregnancy? How is it teratogenic?
It's teratogenic because it's fat soluble, which means it easily crosses the placenta. And that means
But if-
when it's inside the baby, what's that?
I was just gonna say, but isn't it like taking vitamin A? So what's the difference? What differentiates this from
But you're gonna have,
any
but you're
vitamin
gonna, but it'd be excess vitamin A. That's too much for a baby. That means you're gonna cause pseudotumor cerebri. That's hydrocephalus for a baby, which can crush the rest of his brain.
A? That makes sense. Thank you.
Yeah, no problem. All right, more antibiotics. Tetracyclines. What do? Tetracyclines, remember T for T, block transfer RNA binding to the 30S ribosome. Tetracyclines, action is always the first thing you want to know. Block, T for T, block transfer RNA binding to the 30S ribosome. Remember, by at. So aminoglycosides and tetracyclines work at the 30S. By at 30, cell at 50. So tetracyclines block transfer RNA binding to the 30S ribosome. That's the main action. What do they cover? All gram positives, including Staph aureus. simple gram negatives, and all your atypicals. What's the first line drug for all your atypicals, Gustavo? No. Now vancomycin. All right, Solange? Yeah, remember the macrolide is the first line. Yeah, tetracycline is the second. All right, so anyway, tetracyclines cover a lot, but no anaerobes. They don't cover any anaerobes at all. All right, main side effects, GI upset. Because these are strong acids, should I take it on an empty stomach or with food? Melissa? Strong acids, should I take it on an empty stomach or with food? Which one? Empty. Remember, when stomach's empty, it's acidic. Remember, acid absorbs an acid. Yeah, remember, this is one of the ones. This and quinolones, if you take it with any food, you're not absorbing it. You're literally just pooping it all away. Okay, so watch out for that vignette. All right, so tetracycline's got to be taken empty stomach. Number two, there were cases years ago where they found a pill still stuck in their esophagus. So that's because it erodes right into the wall and then it won't come down anymore. So you got to make sure the person stays sitting up or standing up for half an hour after they take this. And they should drink it down with a full glass of water so it flushes through the stomach into the small intestine. Next one, photosensitivity. So when they go outside, they need to wear an SPF of what number, Rachel? 30 minimum. Which blocks what percent of sun rays? Which one? 97. Who's trying to block? UVA or UVB? B for bad, B for burn. All right, so tetracycline revs up P450 system. Binds calcium tightly. That's how you get that permanent graying of teeth. You'll see it in the deciduous teeth and in the permanent teeth. I mean, it binds and won't let go. Tetracycline, permanent graying of teeth, binds calcium so strongly. By binding calcium so strongly, it causes Fanconi's syndrome. You guys remember that protein in the proximal convoluted tubule that transports calcium, magnesium, phosphate, amino acids, and sodium. That's the one it blocks. That means you lose all of that. All right, tetracyclines. All right, for the top, tetracycline and oxytetracycline are generic now. So real cheap, easy to buy. Minocycline turns your skin blue. Hey, what other drug do you know turns your skin blue like that, Josh? There's another drug out there that turns your skin blue, Mike. Amiodarone. So you got two now that turns your skin blue. Minocycline is first line for acne. I gave you that already. Minocycline is also used to treat rosacea. This is that malar erythema that some people get. Demicocycline blocks ADH receptors. Remember nephrogenic DI? What's the number one drug that does that, Lawrence? Lithium. But now you know there's a tetracycline as well. And doxycycline is the only hepatically excreted tetracycline. So somebody who has renal disease, then this is the one you use. Or somebody who has liver failure, this is the one you don't use. I don't know how they're gonna ask you an exam, but you gotta know. Tetracycline is an acid, which means they're water soluble, but there's one. They made basic, so it goes to the liver. Any questions on tetracyclines? Cool. Last gram negative, gram positive, Listeria monocytogenes. Listeria is a bacteria, yes it is. However, it is a purely intracellular bacteria. If you're intracellular bacteria, what cells are gonna be chasing you? Humoral cell mediated, Victoria.
Humoral.
No. Remember, if you go intracellular, it's gotta be cell mediated now.
Oh, right.
Yeah, just look at his last name, monocytogenes. He invites monocytes over, which then become macrophages. So easy to remember, just look at his name. So that's why they like to ask about this one. So again, you can't pick B cells and neutrophils. You got to pick T cells and macrophages for this one. It's intracellular. It hardly spends any time in the blood. It used to be the only gram-positive with endotoxin. Remember, so I got to erase this whole line. There is no gram-positive endotoxin. They changed it a few years ago. But you get granulomatous inflammation, loves attack placentas, and causing abortions. So if they got a mom who ate something, had diarrhea, and then the baby aborted, there's your guy. Listeria, like Vibrio, loves iron. So people with hemochromatosis, increased incidence of Vibrio and Listeria. Causes very high monocyte count. If you remember Steele's, 5 infections with the highest monocyte count I've given you before. It causes neonatal sepsis. Remember Baby Bell? This is the L. In adults, it causes gastritis associated with spoiled milk. The most common way people get it. Now, remember, if it's just regular milk, that's Staph aureus. This is spoiled milk. So you got to read carefully what they say about that milk. All right. Migrant workers, because they were eating cabbage out in the field. Raw cabbage, because that's what they were eating. And then hot dogs, because hot dogs contain spoiled milk. And then Listeria is one of 4 curved rods. Name one more curved rod, Leslie.
H. pylori.
H. pylori, name another one, Olivia.
Vibrio.
Vibrio, there it is, folks. 4 curved rods. Make sure you know them. And there it is. A nice little poem written by one of my favorite guys. I wrote this. I remember I was at a conference. I was missing my honey, so I said, I'm going to write her a poem. I'm going to write a poem. That way, I would send it to her by email. She would read that and say, "Oh, my handsome prince, come home to me. Come home to me." Yeah, that way I figured by the time I got home, she'd be climbing that mountain. You guys expect a romance. All right, cool. But anyway, all right, enter gram negatives, folks. I told you it goes fast. We're just going to keep flowing till we get them all done. Huh? Oh, was that Mabel? Oh, yeah. Oh, Mabel hasn't even checked in. I haven't seen Mabel. Mabel, are you in there?